Hey guys, how are y'all?
Hey, I've just been trying to study for my upcoming physics exam. What about you?
I have to get a root canal next Thursday, and I'm kind of nervous.
What are you nervous about?
I'm getting a root canal, and I don't really understand how the anesthetic numbs my gums.
When you go to the dentist will apply local anesthetic to your gums right before your oral procedure. The anesthetic works on a cellular level within our bodies to make sure that we do not feel pain.
To better understand this, we should take a closer look into the function of the cells that are inside of us. There are two forces that drive the diffusion of ions across the plasma membrane: a chemical force, which is the ion's concentration gradient, and an electrical force, which is the effect of the membrane potential on the ion's movement. There are more positively charged ions outside of the cell than there are inside of the cytosol, which makes a relatively more negative charge on the inside of the membrane compared to the outside.
Pumps in the cell membrane work based on chemical gradients, or how much of one solute is on one side and how much is on the other. The sodium-potassium pump works based on a chemical gradient and allows anesthesia to bind. This pump causes the movement of sodium and potassium ions to create an electrochemical gradient that in turn creates nerve signaling to tell your body what to do. When anesthesia is introduced, it inhibits this pump so that the nerve impulses and pain can't be felt.
But wait, what does this have to do with physics?
Well, this environment created in the cell membrane is synonymous with an electrical circuit and it follows the same principles.
To better understand this comparison, we must define a couple terms. First, the current, I, is the rate of flow of an electric charge in a circuit, which is the movement of ions across the cell membrane that is driven by electrochemical gradients.
The resistance, R, is a measure of the opposition to current flow in a circuit. The resistance is determined by the number of open ion channels.
The voltage, V, is the electropotential difference between two different points. Voltage is caused by the separation of opposite charges in our cells because of the membrane. The voltage across the cell membrane is called voltage potential and is important for conduction of electrical impulses along nerve cells within the body.
So a good equation to help us better understand electrical circuits is Ohm's law, which describes how voltage, current, and resistance are all related.
So back to our cells so I can better understand this. The circuit is the cell membrane, and the anesthesia works in our cells by blocking the ion channels in the cell membrane, reducing the amount of sodium going into the cell, thus decreasing the current. So basically, it lowers current flowing across the membrane, which decreases the voltage potential.
Yes, exactly.
So the anesthesia is seen working like a resistor in our body, so it inhibits current.
You got it, dude.
The higher the membrane resistance, the lower the current, and thus the less we perceive pain, which causes a feeling of numbness at the procedure site.